Hello, everybody. Welcome to a new live stream of Actual Edge on December the 2nd, 2023. Just a day after of the World AIDS Day yesterday on the 1st. And as you come in, I just wanted to thank everybody and acknowledge yesterday's World AIDS Day. It's a day that holds deep significance for Actual Edge, a day of reflection, remembrance, and above all, resilience in our shared battle against HIV and AIDS. I want to extend my heartfelt gratitude to each and every one of you watching our channel. Your presence here means the world. Your support, your engagement, and your subscription to our channel is what keeps our community strong and vibrant. Thank you for being part of this journey and for making a difference by being here. Yesterday, World AIDS wasn't just another day on the calendar. It was a reminder of the challenges faced, the lives touched, and the progress made. It's also a call for us to continue our efforts in spreading awareness, combating stigma, and providing unwavering support to those affected by HIV. For many people joining us here, living with HIV is part of their reality. Their strength, their stories, their resilience, and the beating heart of our community. Today, as we come together, let's reinforce our commitment to supporting one another, dispelling myths, and creating an environment of empathy and understanding. Let us remember those we've lost and honour their memory by advocating for improved healthcare, better access to treatments, and an end to discrimination. Together, we can redefine the narrative around HIV and AIDS to create a world where everyone receives the care, respect, and support they deserve. So, to each one of you subscribed to our channel watching this live stream, it might be here or it might be re-uploaded. Thank you. Thank you for being part of this community, for your support, and for helping us spreading awareness and fostering an inclusive space. Know that you are seen, valued, and appreciated. Your support makes a difference. Thank you again for joining us on this live stream. Let's continue to educate, support, and uplift each other. Together, we are stronger, and together, we can make a lasting impact. Welcome, everybody, to this live stream. Today, we're going to be answering questions and reading a few pieces of news related to HIV and AIDS for the last 9 or 10 days. As we already said, yesterday was a very big day in the cure for AIDS and HIV. To be honest, I think that this year, celebrating the 35th year of the World AIDS Day, we can determine that never had we had such a good scenario for HIV. Why is this? Well, number one, because now we have a lot of people whose virus has ended up disappearing, or even for them that have been in remission for some time now. We have medication such as ART, such as PrEP to avoid getting HIV. A lot of people have claimed that medicine to treat cancer has also shown to work against HIV. So we can say that we never have been as optimistic as we are right now. All right, let's see what you're up to in the chat. Thank you, El Duende Satírico, for moderating this today. Hello, David Peserin. And hello, Brandon. I see you have a question. How many methods are trying for cure like AGT, EBT, etc.? Well, that's a very good question. There's various approaches that are being explored in the pursuit of a HIV cure. Now, it's important to note that finding a cure for HIV is a complex challenge, and researchers are investigating multiple strategies every day. Some of these methods being explored include ART, as you already mentioned, while not a cure, is the standard treatment for managing HIV, as it helps control the virus, reduces the viral load, and maintains a healthy immune system. Gene therapy is what we've talked about many times at this channel with techniques such as CRISPR or Cas9, and they're being researched for the potential to modify the genetic material of cells infected with HIV. This area is known as gene therapy, and it holds promise for disrupting the replication of the virus. Another system is the stem cell transplants. The problem with this one is that it's quite expensive, but researchers have explored stem cell transplants from donors with a specific genetic mutation, which is CCR5 or Delta 32, that makes individuals resistant to the virus of HIV. This approach was famously used in the Berlin patient case, which you have a video in our channel. Finally, one of the last methods that we could use are BNABs, broadly neutralizing antibodies. Researchers investigating the potent antibodies have realized that they can neutralize a wide range of HIV strains. Strategies to enhance the immune system's ability to control or eliminate HIV are being explored. These would be in vaccines and immunotherapies. And finally, latency reversing agents. There are substances that help reactivate the dormant HIV in latently infected cells, making them susceptible to the immune system or antiretroviral drugs. So thank you very much for your question, Prandan. It's important to clarify here that despite having a lot of methods and potential methods, Joe Biden just yesterday said that they will find a cure before 2030. I'm not asking you to agree politically or disagree politically with Joe Biden's ideology, but at the end of the day, he is the president of the United States. And to make such a statement should make us all be more aware, more conscientious that we are getting closer to a cure, and it is very likely that we'll end it by 2030. All right, we have another question from Bezad. Can we conclude that CRISPR is failed, or there is just a difficulty on its progress? Well, I wouldn't say it has failed, but we have discovered certain problems that it may have. So, while it's not necessarily a failure of CRISPR technology, it is still a revolutionary gene technique editing tool that has significantly advanced molecular biology and genetic research. It does allow scientists to precisely modify genes in a variety of organisms. So the progress of CRISPR technology is ongoing. Some researchers continually working on redefining technology, improving its accuracy, and addressing any concerns. For now, a lot of scientists believe that CRISPR would end up being the final cure for HIV, Mr. Bazad. If it's too soon for us to speak, we can't. What I want to say here, Mr. Bazad, is we cannot confirm that the CRISPR technology will be the one designed to cure HIV. But what we can guarantee is that we will have a positive contribution from this aspect of science to any new one. So thank you very much for your questions, guys. And I wanted to comment on this Joe Biden speech from yesterday, which I think is quite interesting. On December the 1st, President Joe Biden marked World AIDS Day by issuing a stirring proclamation, reaffirming the commitment of the United States to continue to fight HIV epidemic, both domestically and internationally. We have a question. Haitha Basumatarai. When will the medicine for HIV arrive? Well, I'm not sure if you're aware, but there's already certain medicines available for HIV for preventing it. It's called PrEP. and PREP, that is, sir, just in case you would like to write it down, and ART in order to fight the virus and not allow it to spiral out of control in your body. Now, if your question is when will we get a cure, a medicine that cures HIV, not that puts it to sleep or gives it a rest in your body, a medicine that will cure HIV, it's hard for us to give you a specific date. But I'm not sure if this might be reassuring. But yesterday, President of the United States, Joe Biden, said he was very optimistic in its fight against HIV for 2030. That is the same date given by the WHO. Now, we need to take into account that governments around the world always try to, they cannot give you a date that is too close to now, because let's say they say, oh, it will be available in 2027. And then by 2027, it's not available. A lot of people, I know a lot of people that follow Actual Edge, have HIV, and they don't have time for anyone to play with their emotions and saying, the cure is going to arrive this year, the cure is going to arrive next year. So what do they say? The cure will be available by 2030. That gives them enough time, and if it's ready before that, well, it might come out again, and it will be available in many countries under the medical patent of very likely the United States. So we cannot confirm if the price of this medicine will be expensive. It will surely be over the 2 decades after it's released. However, if it's a one-time injection or a one-time pill, it would definitely be worth it because it would confirm the cure. Thank you very much for your question. And we have another question by Fel Candilada. Fel Candilada asks, the question is, when will medicine come out? We are tired of waiting and still won't come out tomorrow. As I was just saying, Fel Candilada, we are extremely upset and we can totally empathize with what you're feeling. We understand the frustration and impatience regarding the quest of a HIV cure, especially if you come to channels that speak about it a lot, that we're always trying to remain optimistic. You probably feel like we're not giving you the cure because we don't want to. The thing is, the timeline for medical breakthroughs, including the development of a cure, is challenging to predict precisely. While significant progress has been made in HIV research, and there are promising developments in treatments, the specific arrival of a cure remains uncertain. Medical research involves rigorous testing, trials, and regulatory processes to ensure the safety and efficacy of any new treatment or cure. In the meantime, it's crucial to continue following the guidance of healthcare professionals. And just to let you know, Fel Candilada, the President of the United States said yesterday that there will be a cure, and he's urging all collective efforts to end HIV epidemic by 2030. So there is room for optimism. The cure is closer today than it was yesterday, but we cannot predict exactly when it will come out. I know you're tired of waiting. I know it will not come out tomorrow. But for now, we need to wait and believe in the power of science and in the official organisms and governments that are dealing with this, which is the WHO. Thank you very much for your question. And now we're going to cover Joe Biden's speech. Let's get some highlights of what he said. In the meantime, if you have any questions, please paste them in the chat box and we'll be happy to answer as soon as we are ready for it. Let me drink a little bit of water. All right. So yesterday on December 1st, President Joseph Biden marked World AIDS Day by issuing a stirring proclamation, reaffirming the commitment of the United States to combat the HIV epidemic both domestically and internationally. President Biden's proclamation resonated with a call to action, urging collective efforts to end the HIV/AIDS epidemic by 2030. Noting significant advancements in HIV prevention, detection, and treatment, the President acknowledged the lingering challenge posed by approximately 39 million people worldwide, including over 1 million individuals within the United States living with HIV. Highlighting strides made during his administration, President Biden emphasized historic steps taken domestically. These include reviving the White House Office of National AIDS Policy and launching a comprehensive national HIV/AIDS strategy aimed at ending the epidemic within the US by 2030. Moreover, President Biden outlined crucial funding requests seeking 850 million US dollars for the Department of Health and Human Services, ending the HIV epidemic initiative. This initiative aims to significantly reduce new HIV cases, combat stigma hindering access to care, and enhance the availability of pre exposure prophylaxis, also called PrEP, a vital preventive drug against HIV transmission. Internationally, the President underscored the critical role of the President's Emergency Plan for AIDS Relief in reducing transmission and expanding testing, and saving over 25 million lives in partner countries over the last 2 decades. President Biden is advocating for a clean emergency plan for AIDS relief reauthorization bill to extend this life-saving program for 5 more years, emphasizing the goal of ending HIV and AIDS by 2030 on a global scale. The President's proclamation serves as a rallying call for unity and dedication in the fight against HIV and AIDS. As we commemorate the 35th World AIDS Day, President Biden's commitment to resolve the crisis of this virus and to eradicate the stigma and impact of the disease inspire hope for a future without this horrible virus of HIV. We have here Mr. Bazad. Anyway, nothing should hold us back from living our lives. Absolutely, Bazad. Your perspective is completely true. I couldn't agree more with it. While waiting for advancements in medical research, it's essential to live life to the fullest, focus on overall well-being, and cherish meaningful moments. We can't be all the time feeling guilty all the time. We can't put a limit to our life. There is ways of living with HIV without feeling the burden of it. But it's very important as well to listen to your local doctor, Mr. Bazad, because at Actual Edge we can only give you some general tips, but it's always your medical doctor at your local hospital that will be able to give you the appropriate recommendations. And remember always to stay connected with support networks. Here at Actual Edge, we live stream every single Saturday at 4 p.m. Thailand time and 2:30 India time, and I believe it's 1:30 a.m. At the US time. So we do currently have a lot of slots to provide you support and maintaining a positive outlook, contributing significantly to a fulfilling life. Remember that you're not alone, and there's an ongoing process here, Mr. Bazad. And if you have any specific concerns or questions, we are always willing to help here at Actual Edge. Now, another piece of news I wanted to comment today is one that is not as positive as the one stated previously. As we already mentioned a few times, yesterday, December the 1st, was the World AIDS Day. But we also had publishing of the Centers for Disease Controls and Prevention, and they highlight a distressing reality. Among individuals receiving HIV medication, young children face the highest risk of mortality, largely due to delayed diagnosis and treatment interruptions, which it's very sad. It's a very sad piece of news that we have to give here today. We're not used to giving these extremely devastating pieces of news, but at times we really have to, because we know there's always room for optimism, but we also need to inform about others. Oh, I see there's a question here by Ben Abid. Do you think gene therapy is only way to cure HIV? Do you think the price of the treatment will be subsidized? Difference between a cure and a vaccine, and which one will be the first? Okay, so there's a few questions here. The pursuit of a cure for HIV involves various approaches, and gene therapy is most certainly one avenue being explored. Gene therapy does show promise. It's not the only way being investigated. Like other strategies include antiretroviral medications, immunotherapies, and even vaccines. In one of the previous answers we gave, we clarified all the ways. But regarding the price of treatment, that would be a complex issue. First of all, Mr. Ben Abid, I would like to know where you're from so we can give a little bit more information considering your country. Because we know that European countries, for instance, do subsidize medicine for their citizens, at least the UK, Ireland, the Netherlands, Germany, France, Spain, Italy. It would be very easy for someone to get a medication. But again, if we go to the US or India or other countries in sub-Saharan Africa, we might not be as lucky. So the price is a complex issue. Affordability and accessibility are critical considerations for any effective HIV treatment. Subsidized partnerships and an advocacy plan have a very important role in making treatments more accessible to a broader population. The aim is to balance the need for innovation with the necessity of providing affordable healthcare. It's essential to differentiate between a cure and a vaccine. This is your third question. A cure implies the complete eradication of the virus from the body and from our society, allowing an individual to no longer require an ongoing treatment. Achieving a cure involves addressing reservoirs of the virus in our bodies and also monitor closely so we know it's no longer there. Now, a vaccine aims to prevent the HIV infection. It stimulates the immune system to recognize and fight the virus if exposed. While there's no HIV vaccine that provides complete immunity, research continues making progress every day. As of now, a functional cure of a vaccine that provides long-term immunity remains a challenge. Both areas of research are active, and the scientific community is working very hard to advance our understanding and develop effective solutions. All right, and okay. So, as we were saying, Prandam has a question. May we hope that the cure will become possible within 2030 or 2035? Well, the WHO set that the goal is to cure HIV by 2030. I think this is more than possible, Mr. Prandan, especially with the President of the United States confirming this information yesterday through a very important proclamation. We can honestly say that it's closer than it's ever been. I'm going to say that it will be available 100%, well, not 100%, but 90%, according to my personal beliefs, according to my research, according to our PhD friends, virologists, that are working nonstop on this. I could say 90% certain that it will be before 2035. By 2030 is the official date confirmed. If the WHO doesn't provide a cure by 2030, how will that make them look? Just think about it. They're going to look like liars. They're going to look like they can't hold up for their words. They can't be held accountable for the information that comes out of their mouths, out of the biggest health organization in the world. We need to trust science. We need to trust them. I know at times it's difficult. I know at times it's frustrating, and we may think that loads of companies are making money from it. But we need to believe that what the WHO says of ending the HIV epidemic by 2030 is a reality, and it's going to happen. And we need to be on this boat together. Every day we are getting closer to it. We have another question here. Oswalda, when is the cure expected? And these vaccines, medicines will cure HIV also. Well, HIV 2, it is important to note that HIV 1 and HIV 2 are very different strains of the virus. HIV 2 is less prevalent and primarily found in West Africa, although cases have been reported in other regions. The two strains have some differences in their genetic makeup and progression of the disease that will play an important role when finding a cure for these, Ms. Oswalda. Research efforts are generally focused on addressing both HIV 1 and HIV 2, but advancements in treatments and cure strategies for one strain may not necessarily apply directly to the other. Although it wouldn't be that far off, the development of treatments and vaccines involves careful consideration of the specific characteristics of each virus. For the latest information on HIV research, potential cures, and vaccine developments, it's recommended to stay informed about what health organizations say, Ms. Osvalda. And the cure is expected by the year 2030, confirmed by the WHO and by Joe Biden, the President of the United States, yesterday on World AIDS Day. So, Ms. Osvalda, it's closer than it's ever been. We cannot give you a specific date. We would love to, but unfortunately we can't. We want you to know that this is your place for support. Okay, so thank you very much for those questions. Now, I'm going to read to you some news that isn't as optimistic for the younger ones. Please continue to write the questions, and as soon as I am prepared, I'll continue to answer them. Recent data released by the Centers for Disease Control and Prevention highlights a distressing reality. Among individuals receiving HIV medication, young children face the highest risk of mortality, largely due to delayed diagnosis and treatment interruptions. According to the CDC's Morbidity and Mortality Weekly Report published on December 1st, on the same day of World AIDS Day, many children under 5 are diagnosed with HIV at a point where their immune system is severely compromised. Regrettably, once these young patients begin antiretroviral therapy, ART, they are more susceptible to treatment interruptions compared to older age groups. The effectiveness of ART relies on consistent medication intake to suppress the virus to undetectable levels. Interruptions in treatments often lead to viral rebound and the progression of the infection towards AIDS, posing a significant threat to these vulnerable children. Moreover, in low resources settings such as regions in sub-Saharan Africa, where a significant number of these cases occur, children face increased mortality rates from coexisting conditions such as pneumonia and malnutrition. These additional health challenges compound the risks associated with HIV infection, further escalating the probability of mortality among affected children. The report also sheds light on the underreporting of death and treatment interruption rates, citing difficulties in tracking data and children being lost to follow up. Experts emphasize the urgency of prioritizing children's HIV services to ensure consistent access to ART and prevent avoidable deaths. Early diagnosis, immediately initiation of ART upon diagnosis, and comprehensive healthcare measures, including vaccinations and nutritional support, are crucial steps to address this critical issue. While there's been a decline in new HIV infections among children globally, the unfortunate reality remains that a significant portion of children diagnosed with HIV don't receive the necessary treatment. In 2022 alone, an estimated 84,000 children died from AIDS-related illnesses. This underscores the urgency of targeted interventions to improve access to care and treatment for the young ones. Efforts are underway globally to expand HIV testing and ensure timely access to appropriate care for children living with HIV. The ultimate goal is to protect these young lives from both HIV related complications and other preventable health challenges. As we confront these challenges, the collective and commitment to early diagnosis, consistent treatment, and comprehensive care remain essential in safeguarding the well being of our youngest and most vulnerable population living with HIV. I This is a very sad piece of news, especially considering that most of these kids are in areas where they're so poor and they have so many diseases and a lack of medicine that they can never access. Anyway, we have another question. I'm sorry, I'm getting distracted. I'm now 25. Can I expect to survive 60-year above with ART medicine? Well, with effective ART and proper medical care, many people with HIV are able to live long and healthy lives. The life of expectancy of individuals with HIV has improved over the years due to advancements in antiretroviral medications. When HIV is well managed with ART, it can help suppress the virus, maintaining a healthy immune system and reducing the risk of developing any other infections. So, some factors that can influence life expectancy could be access to the medication, the if you live in a country where it's easy to access, the treatment plan will impact the control of the virus. Access to healthcare also essential. That's why at Actual Edge we always promote public healthcare. It's important to have regular medical checkups and maintaining good taking care of your diet, exercise, and avoiding other health risks like smoking or drinking alcohol. And also the viral load and CD4 count. Maintaining an undetectable viral load and a healthy CD4 count are essential to live a long, healthy life. And also maintain a control of coexisting conditions. These could be heart diseases, lung diseases. So it's important to just work closely with healthcare professionals. And as medical factors continues to advance, I'm convinced, Mr. Pradnam, that you will live a long and healthy life without any major issues, just as healthy as someone that doesn't have this terrible virus. Thank you very much for continuing to answering your questions. We have another question from Mr. Ben Abid. The difference between a functional cure and a sterilizing one, will people infected will test negative again, or human bodies will keep antigens even if the virus DNA is cut in case of gene therapy? Okay, so let's start with your first question. Let me drink some water first. The difference between a functional and a sterilizing cure. Okay, so they represent different levels of success in HIV treatment. A functional cure is when the virus is in remission or under virological control, referring to a state in which the virus is suppressed to undetectable levels in the absence of antiretroviral therapy, ART. Although the virus may not be completely eradicated from the body, the immune system is able to control it effectively. Now, a sterilizing cure is also known as complete cure or eradication, involves the complete elimination of the virus from the body. In this scenario, all viral particles are removed, and the person's immune system is no longer burdened by HIV. If a sterilizing cure were achieved, an individual would test negative for HIV, and there would be no residual viral genetic material in the body. So, we had sorry, let me go back to your question where people have antigens even if the virus. So research in the field of HIV cures, including gene therapy, is still ongoing, and scientists are exploring innovative approaches to address that challenges associated with achieving a sterilizing cure. Now, it's in the context of HIV and potential cure strategies. We need to make a distinction between viral RNA and antigens. Okay, so viral RNA and DNA. RNA testing is most routine HIV tests, such as viral load test, detect viral RNA in the blood. If a person's viral load is undetectable, it means that the amount of HIV RNA in their blood is below the limit of detection for the test. This doesn't necessarily mean the virus is completely eradicated from the body, but rather at very low levels. Now, if we speak about DNA integration, HIV has the ability to integrate in its genetic material into the DNA of host cells. This integrated viral DNA is called provirus. Achieving a complete cure would involve eliminating this integrated viral DNA, which poses challenges. If we speak about antigens, are proteins or molecular that trigger an immune response. HIV antigen, even if viral RNA is undetectable, the body may still retain memory immune responses to HIV antigens. This is because the immune system has encountered and responded to these antigens. In some cases, individuals who have been functionally cured may still have detectable immune responses to HIV antigens. In summary, even if a person were to achieve an undetectable viral load through advanced treatments or gene therapy, the presence of immune memory to HIV antigens may mean that conventional antibody-based tests could still show a positive result. The concept of test negative in the context of a cure would ideally involve the complete elimination of integrated viral DNA, along with the absence of detectable viral RNA and immune responses to HIV antigens. So, Mr. Benabid, that is the answer to your question. So, just for you to know, people could still test positive. People may still have body responses to the virus. And yeah, we already went over the functional and sterilizing cure. And now I wanted to focus on another piece of news. Which is one is more likely to happen? I'm very sorry, Mr. Benabid. What do you mean between a functional and a sterilizing cure? Is that what you're trying to ask? Which one is more likely to happen, a functional or a sterilizing cure? Please write yes in the chat box if this is your question. In the meantime, while Mr. Benabid answers, we want to go over a piece of news that comes from the United States of America, in which the state of Tennessee has discriminated against people with HIV. So, the Department of Justice has issued a scathing report accusing the state of Tennessee, including the Tennessee Bureau of Investigation and the Shelby County District Attorney's Office, of violating the Americans with Disability Act by enforcing the state's aggravated prostitution law in a discriminatory manner against people living with HIV. According to the Department of Justice press release on World AIDS Day, the enforcement of Tennessee's aggravating prostitution law has led to harsher criminal penalties imposed uniquely due to an individual's HIV status, a direct violation of the Title II of the Americans with Disability Act. Assistant Attorney General Kristen Clark of the Justice Department Civil Rights Division highlighted the law's outdated nature, lacking scientific basis, and emphasized that penalizing individuals with HIV has violent offenders perpetuated marginalization. Sorry, we have another question. Oh, yes, sorry. Yes, you meant functional cure and sterilizing one, and I asked you, and you confirmed that that is what you meant. Okay, well, achieving a functional cure for HIV is considered more feasible and realistic than a sterilizing cure. Why is this? A functional cure would always not be as clear and thorough. A complete sterilizing cure would mean ages and ages of research. So I think that without a doubt, a sterilizing cure is still not as realistic as a functional cure. The reasons for this is because a functional cure focuses on controlling the virus rather than eradicating entirely. And if you watched our videos, you may know that the HIV virus has an immense capacity of mutating like a chameleon into the body's environment. And also, sterilizing cure approaches face significant scientific, logistical, and ethical challenges, and the goal of complete eradication has proven elusive. So, for now, let's be optimistic that we will find a functional cure, and eventually, hopefully in our lifetime, we will find a sterilizing cure. We're going to have a quick minute break so I can get some water. I'll be back in less than a minute. Okay, so we are going to read a piece of news that comes from the United States, state of Tennessee. Tennessee discriminates against people with HIV. The Department of Justice has issued a scathing report accusing the state of Tennessee, including the Tennessee Bureau of Investigation, also called TBI, and the Shelby County District Attorney's Office of violating the Americans with Disabilities ADA by enforcing the state's aggravated prostitution law in a discriminatory manner against people living with HIV. According to the Department of Justice press release on the World AIDS Day, the enforcement of Tennessee's aggravated prostitution law has led to harsher criminal penalties imposed solely due to an individual HIV status, a direct violation of Title II of the Americans with Disabilities Act. Assistant Attorney General Kristen Clark of the Justice Department Civil Rights Division highlighted the law's outdated nature, lacking scientific basis, and emphasized the penalizing individuals with HIV as violent offenders perpetuates marginalization and discourages testing. Under Tennessee aggravated prostitution law, a crime that would otherwise be a misdemeanor is elevated to a felony solely because of an individual's HIV status, imposing severe consequences. Conviction under this law could result in 3 to 15 years in prison and a fine of up to 10,000 US dollars. Significantly harsher penalties compared to a misdemeanor charged for the same conduct, which would yield only up to 6 months in prison and a $500 fine. The Department of Justice underscored that Shelby County has seen the most frequent enforcement of this law. Furthermore, those convicted under aggravated prostitution are categorized as violent sexual offenders, necessitating registration with the Tennessee Sex Offenders Registry, often for life. The consequences of this registration restrict their living, working, and public movement, contributing to increased homelessness and employment among this group. In response to these findings, the Department of Justice has provided the state of Tennessee, TBI, with detailed remedial measures necessary to address these discriminatory practices. Meanwhile, on World AIDS Day, the Shelby County Health Department offer free HIV screenings, providing essential support and services to commemorate those affected by HIV and AIDS. It still shocks me that many people in this day and age continue to not understand what HIV is as a virus, continues to stigmatize a virus that anybody could get. Not every time can people have access to certain methods to prevent practicing safe sex. Not every country in the world has access to the same healthcare. Not every country in the world has access to medication when we need it. So, a very large part of the world, developing world, Africa mostly, have HIV. And these people have it bad. We have comments of them in our channel on a daily basis. They tell us, when will the cure arrive? We are dying. Creating awareness on the day after of World AIDS Day is essential. We all need to work together. And this next piece of news relates with the most popular country that watches us, India. And we have some optimistic news regarding a cure, regarding Indian people having access to PrEP medicine, pre exposure prophylaxis. So, India ranks third globally in the number of reported HIV cases, with 2.3 million individuals affected. Despite this high prevalence, public awareness regarding preventive drugs for HIV remains significantly low. Efforts have been ongoing to raise awareness about HIV and AIDS among the population in India. However, a critical shift in approach involves the widespread adoption of pre exposure prophylaxis, also called PrEP. This would be done to curb HIV transmission. Dr. Atul Patel, an infectious diseases specialist, emphasizes the needs to bolster efforts to expand PrEP usage and educate high risk groups about its benefits. PrEP is a preventive measure involving the use of antiretroviral medications to avert HIV infections, particularly effective for individuals at high risk due to injection, drug use, or sexual exposure. In 2015, the World Health Organization, the WHO, recommended oral PrEP, specifically the tenofovir disoproxil fumarate based regimen, as an additional prevention choice for those facing substantial HIV exposure. Despite this recommendation, its acceptance remains limited owing to insufficient awareness among target groups. Dr. Patel highlighted research indicating a lack of awareness among high risk individuals, particularly within the men who have sex with men, MSM, and transgender communities. Yet, upon receiving information about PrEP, a notable percentage of individuals expressed willingness to adopt oral PrEP. Dr. Patel stressed the need for advocacy efforts and multidisciplinary approaches, emphasizing tailored education campaigns for key population to boost PrEP awareness. Regarding this effectiveness, Dr. Patel underscored multiple studies affirming PrEP's efficacy in preventing HIV infections. However, he emphasized the critical role of adherence, and barriers to PrEP include stigma, doubts about efficacy, complexities of timing and schedule, and other PrEP related characteristics. Monitoring PrEP adherence remains crucial to bridging the prevention gap for HIV. I feel like awareness has guided our discussion today. Every single piece of news we've shared with you today focus on awareness, focus on testing, focus on countries taking the right steps in order to make their population aware that if they have HIV, there are many solutions. That if they're exposed to HIV, there is ways to avoid getting it. That if you already have HIV, there is medicines, antiretroviral therapies, ARTs, available in your country, so you are able to live with the virus without having any form of worry, any issue, without your life being anything different to what it was before having this terrible virus. We believe in ending this virus. We believe that we are closer than ever. Over the years, significant strides have been made in treating HIV infections, thanks to the development of highly effective antiretroviral drugs. Like these medications have revolutionized HIV treatments since the mid 1990s, effectively suppressing the virus replication and rendering it non transmissible. Patients typically receive a combination of these drugs tailored to various stages of the HIV cycle. Hendrik Streeck, Hendrik Streeck, he's an AIDS research specialist and director of the Institute of Virology at Bonn University Hospital, highlighted the remarkable progress in HIV treatment, particularly emphasizing the significance of integrase inhibitors. These inhibitors prevent the integrase enzyme from integrating viral DNA into host cells, proving enormously effective in treating patients with resistant viral infections. However, ongoing research aims not to enhance the efficacy of existing drugs, but also to minimize side effects and simplify treatment administration. Some studies focus on implant based methods that release drugs into the body at defined intervals, potentially replacing daily oral medications with annual injections. Well, what was the White House announcement about a cure made yesterday? Well, yesterday, President Joe Biden, Mr. Ben Abid, made a statement, made a proclamation, made an announcement about fighting HIV, about creating awareness, about reinstalling programs to help people in the US deal with HIV, calling for action, and claiming that it will be possible to end HIV before 2030 if we all take the right steps in the right direction. So that's basically it, Mr. Benabid. My moderator, El Duende Satirico, has shared a link in which you can read the entire proclamation. And if you have any questions or if you don't fully understand any of the concepts there mentioned, you can come back and we'll happily assist you resolving any issue you have with it. So, as we were saying, despite advancements in medical treatments for HIV, the development of a HIV vaccine remains elusive after decades of research. Streak highlighted the challenges, citing setbacks in recent vaccine trials due to the virus's ability to constantly mutate, to constantly change its generating numerous variants that evade certain antibodies and vaccine efforts. It's a very smart virus. It keeps changing its genetics in our body. I think during our last session live, I also mentioned, why did they find a vaccine for COVID so quick? Why is it taking them such a long time to find a vaccine for HIV? I think this is the number. A lot of people got COVID worldwide, regardless of their race, regardless of their social status, regardless of their position in the globe. HIV affects countries that are not developed. Well, also developed countries, but a lot less, because developed countries have better conditions. Would pharmaceutical companies be as disposed as helping if it was Europeans or people from the States or Canadians? It would probably be cured already. But because at the end of the day, pharmaceutical companies, they chase a profit. At the same time, they're also chasing science. But they need to find a balance between these two. We know for a fact that their intentions are good. They're trying to promote the medical advancements that will lead to a HIV cure. But it can't go as fast as the COVID vaccine, because not many people are affected by it. Not many people will take it. So that's why, as we mentioned earlier, awareness is the most important thing. While the quest of a HIV vaccine persists, lessons from AIDS research have significantly contributed to the development of other vaccines, especially the mentioned COVID-19 one. Despite setbacks in vaccine trials, Streak remains hopeful about the ongoing fight against HIV and AIDS, underscoring the importance of education, widespread access to testing, prophylactic measures, and medical treatments to contain this pandemic. Now, we're going to continue with another piece of news that I missed earlier that I also wanted to tell you about, which is very interesting. Um, right now, we already mentioned a few times that by 2030, we will have a cure. Europe has also spoken about this. Ahead of World AIDS Day, a new report from the WHO emphasizes the essential role of timely and tailored testing to meet global HIV reduction targets by 2030, shedding light on the current status of HIV across European countries. The United Nations Global AIDS Strategy aims to end HIV as a public health threat by 2030, setting ambitious targets for countries to achieve. However, the recently released report, a collaboration between WHO and ECDC, based on 2022 data, highlights the considerable strides still needed for European nations to reach these targets. While significant progress is evident in some areas, the report indicates a disparity in meeting the outlined targets. The EU average HIV diagnosis rate stands at 86%, falling 9 points below the 95% target. Although the 95% of diagnosed individuals are receiving treatment, with 93% achieving viral suppression. The new increase in HIV diagnosis in 2022, despite a pandemic related decrease in 2021, is seen as a positive shift, signaling improved accessibility to testing, treatment, and support services across the European Union. ECDC's director, Andrea Ammon, acknowledged both progress and persisting challenges, emphasizing the need for continued efforts to amplify HIV testing, treatment, and support services. The report reveals a diverse HIV landscape in Europe, identifying 2.4 million people living with the disease. It highlights geographical variations in diagnosis, with the eastern region accounting for the highest percentage, emphasizing the need for nuanced strategies catering to different communities, such as prisoners, sex workers, migrants, and marginalized groups. So, the optimism remains at a strong point right now. We've mentioned India, we've mentioned United States, we've mentioned Europe, the European Union. Now, South Africa, they're also having a good fight against HIV and AIDS. Now, we have another question by Mr. Ben Abid, but in the White House, actually, it announces promoting preventive vaccine, not curative. Well, I don't think Joe Biden made it as specific as that, but he most certainly is referring to preventive, not curative. We can confirm this. Right now, whenever you read any news about a cure, always think about it as a preventive cure, not like a permanent one. So, as we said earlier, Mr. Ben Abid, according to scientists, according to research, right now, the cure mentioned for that will be available by 2030 will be a preventive vaccine, not a curative vaccine. As science makes progress, we will be able to know more. And just we need to go over the main points of his speech. I already went over it before, but no problem, Mr. Benabid. Requesting on investments to end a HIV epidemic. That is a proclamation he made. He has requested 850 million US dollars to reduce new HIV cases by increasing access to HIV prevention, care, and treatment, supporting research in the US and worldwide. Okay, this is basically what he's asking, and he's calling for fight so they can cure HIV in a preventive way before 2030. All right, and now I wanted to mention a little bit about South Africa. South Africa's fight against HIV and AIDS and progress towards a vaccine. So South Africa is the country that has one of the highest rates of HIV in the world. And with recent statistics from the Human Sciences Research Council, it reveals a decline in HIV prevalence in South Africa, dropping from 14% in 2017 to 12.7% in 2022. Despite this progress, the country aims to reach the UN AIDS 95-95-95 target that countries like Eswatini, also in Africa, have already reached, signifying the need for continued efforts. HIV therapy advancements have improved, yet the absence of a vaccine remains a key focus. CEO Bada Parasai from the Innovative Pharmaceutical Association highlights South Africa's substantial HIV burden globally, urging the need for a vaccine. Although current treatments manage the virus, a vaccine could have a profound impact. While no cure exists, hopes rest on the possibility of a vaccine. Treatment advancements render most individuals with HIV non-infectious over time. Enhancing treatment coverage, currently at 73.2%, is vital to reducing transmission. Promising developments include new HIV medications, shorter treatments for infections like cryptococcal meningitis, and accessible preventive medications such as pre-exposure prophylaxis, PrEP. Questions arise whether a vaccine could prevent HIV or AIDS. The US National Institutes of Health, the NIH, are conducting research on preventing HIV vaccine. Notably, the VIR 1388 vaccine, which we already spoke about in this channel many times, is in a phase 1 trial across the US and South Africa. The vaccine aims to trigger an immune response against HIV without causing disease, utilizing cytomegalovirus vector, also called CMV. The HVTN 142 study evaluates the VIR 13888 safety and immune response in 95 HIV-negative participants. If successful, these trials could potentially pave the way to combat HIV and AIDS. Concerns loom over the affordability of such vaccines, especially for vulnerable communities. Additionally, the preventative injection CAB-LA is effective against HIV transmission, but faces cost challenges in South Africa. BIIV Healthcare, the UK-based manufactured, licensed Indian pharmaceutical companies to produce generic CAB-LA, potentially offering affordable alternatives by 2027. Until then, the cost of branded drug needs to reduce significantly. A very important part. Okay, sorry, Mr. Benabid, I didn't read your comment. I mean the people who are not infected for those already infected. So it already includes people who are already infected. The plan of the White House emphasizes various initiatives and strategies for preventing new HIV infections, but also for supporting individuals who are at risk of contracting the virus. It discusses measures such as the PrEP and highlights efforts to increase awareness, access to testing, and engagement in HIV services. So it's providing support for people infected and people who are not yet infected or might be. Okay, so guys, we don't have that much time left. So if you have any questions, any other issues that you want us to continue assisting you with, now is your time, because in a few minutes we will be gone. But I don't want to end our live stream today without thanking everybody here, without thanking all of our subscribers, all the people that hit the like button, all the people that comment on all of our videos, all the people that have watched our videos and don't comment and don't subscribe, but they still come to us every time we release a new video. Our goal is heading towards a cure. And while we're on that process, making everyone feel optimistic, have an optimistic approach towards ending this disease. I know at times you may think that we are giving fake information. You may think that we are playing with people's feelings. You may think that we are trying to make money from this. It really makes me upset. The only thing we do is research and make videos to communicate any new piece of update regarding the virus, usually trying to focus on curing the virus. That's all we're trying. That's all we want for our viewers. You coming here seeking for support makes us happy. You sharing that you have this virus makes us happy. We are all a community. We can all give support to each other. We understand the struggles of living with HIV. We talk to people who have HIV every day. We talk to people who research HIV every day. We are always there for you. You can come to our live stream, and even if you might not have a question, you might just want to share something. You might want to let us know that you got HIV, that you're worried, that you're anxious, that you don't know what to do. I will always advise you to please let us know where you're from when you make a comment, because many times you ask us, how can I get this treatment? And we need to know where you're from so we can know also what brand of ART is available in your area. We know that VIIV Healthcare in the UK has given the medical patent to many pharmaceutical companies in India to distribute medicine. So I think it's important here to in a way, try to create awareness and do our own research as well by going to the doctor. Oh, Mr. Isesefalaglu, welcome back to the channel. I see you made a comment in Turkish. Even if gene therapy is done, I heard the doctors that the virus can become active again through the circulation from the lymph nodes. Is that true? It is true, but however, let my moderator get our official documents regarding your question, and I'll answer it in English, and he will provide the answer in Turkish in the chat box. Gene therapy is a very broad term, and the effectiveness of any treatment can depend on various factors. If you're referring to gene therapy for HIV, it's crucial to note that while gene therapies aim to modify genetic material to address diseases, the success and long term of the outcomes can change. The idea of the virus becoming active again through the circulation from lymph nodes might be a consideration because HIV is known to establish reservoirs in certain tissues, including lymph nodes. So reservoirs are areas where the virus can persist even during antiretroviral therapy, making it challenging to completely eradicate the virus from the body and providing a permanent cure to HIV, Mr. Aise Sifologlu. Thank you very much for your comment. As always, we always enjoy seeing your comment in every single of our videos and your active participation in the channel. Now, guys, if you have any questions, please let me know. We still have some time. Sorry, guys, I'm just making sure that we are not escaping any information that we wanted to communicate. It's a very special day. It's a very special day. We have 11 people in here with us today. We're very happy to have you all. Thank you very much for joining. Don't forget, yesterday was the AIDS World Day. What were you guys up to? Were you doing anything fun, anything interesting? What plans do you have for this entering year? Remember, you can write all of these things in the chat box, all your thoughts, questions. I don't want this to be this space exclusively to speak about HIV. I think we can use it for many other things. We can use it to share our ideas, our hobbies. What do we do to live a life full of joy and full of happiness? And yes, we will have one more minute to make sure you don't have any questions. And I wanted to continue to say thank you to all of you for liking, for sharing, for commenting, for watching, for subscribing. It's an absolute pleasure being part of this channel, Actual Edge, that focuses on finding information, updates, and promoting a HIV cure for all the people infected with this horrible virus. You make this happen every day. You are the reason we are here, and we are never going to stop being by your side and providing support whenever you need. Remember, we live stream every Saturday, and don't forget to like, subscribe, and share the video. If you're watching the re-uploaded version, feel free to leave your questions in the comments below, and we will address them as soon as possible. Thank you very much, everybody. Have a wonderful day ahead of you and a wonderful health. That's the most important thing. Before we finish, we have one last question by Mr. Aise. Let's see. Just in time, Mr. Aise. We were just leaving, and we got your question. Well, let me write the answer for you in the chat box. It's a very good question. Hold on. We have to access our medical documents, that is. So I'll be on it. Okay, here we have it. Let me translate it into the Turkish language, and I'll share the answer with you. Here we have it. Okay. All right, and that we're going to call it a day now. Thank you very much for joining. See you soon. Thank you. If you have any, we see there's 10 people leaving this live stream, living and leaving this live stream. Thank you very much for joining. Thank you very much for being part of it. And we'll see you soon through the next week videos and next week's live stream. Bye, everybody.